Hello everyone and welcome to this webinar on pesticide residue. We are now having 2 hours to make quite a few rapid presentations. We will first discuss the definition of pesticide residues and setting maximum residue limits. Then discuss the dietary risk assessment, then practical tools such as the OECD MRL Calculator and the FAO crop clusters, and then we will share country experiences from Egypt and United Arab Emirates, and then we will have a discussion. So we will now start with our first presentation from Magda Sashana at the OECD, and she will present on the definition of pesticide residue.
Okay, hello everyone, and thank you very much, Valerie, for the introduction. I will very briefly go through the guidance document that we have on residue definition, and more specifically, I will talk about the new edition that is coming up very soon. So we do have already a guidance document that has been revised once in 2019, and you have the DOI to access it. But since then, a lot of experience was built, and we received comments that needed to be addressed. So that's why we've started this process of updating the guidance. By starting this process, actually, we found that it's a very good opportunity to provide more clear guidance for assessing the relevance of metabolites and their inclusion into the residue definition for risk assessment, that we can lead also to the better harmonization of the assessment process and the residue definitions globally. This update also allows us to incorporate the new scientific approaches that are kind of moving away from the animal testing methods to more new approach methodologies, as we call them, the NAMs, that include in vitro and in silico methods, as well as grouping of metabolites and retagrose, and approaches such as threshold of toxicological concern. So this was really an effort to provide additional clarification or extend some areas that needed further explanation and modernize the guidance document. So everything was started by providing detailed and clear definitions in some areas, consider alternatives to animal testing, and developing some very prescriptive decision schemes that then were tested through some examples. By testing basically these decision schemes and all the definitions and the approaches that were described, we encountered some problems. So that's why we had to provide more clarity and rework on definitions, on considerations, and the decision scheme. And that's why it's been like a project, a very lengthy project, but a very rewarding actually, because took some time, but it will provide some more clarity and consistencies. And you can appreciate from this figure that the assessment of metabolites is very complex. It involves lots of definitions like principal versus trace, residues, low versus high exposure. We have the common metabolites, but also conjugated bound metabolites, isomers. All these had to be defined in the guidance. Also, we had this incorporation of new approaches to define toxicological reference, moving away from rat data, but incorporating more modern approaches like grouping, guiding principles, and read across, so we can derive global consistency for residue definition. And all this had to be done not only for dietary risk assessment, but also for having residue definition for enforcement and monitoring. And in some cases, we had to address this dual use of pesticides, because pesticides can be used as plant protection products, but sometimes can also used as veterinary drugs. Furthermore, in some countries, they derive definition of residue for drinking water. So very briefly to explain these two differences in setting residue definitions. So we have the residue definitions for enforcement and monitoring, as I've said, and you can see this is a less complex approach, because what we need to achieve is basically obtain a single marker compound that it should occur in most commodities and should indicate possible non-compliance with good agricultural practices. Another request to have a good marker is that is measurable, and ideally that is easily measurable for national laboratories, because these are the ones who will be monitoring the levels of the residues. And as final requirement is that is specific to the pesticide, so it cannot be a generic marker that is relevant to potentially to other pesticides. Moving now to the other application of residue definition, which is for dietary risk assessment, you can see the complexity here is higher, because we are not talking about one single marker, but we're talking about the parent compound, and on top of that, the relevant metabolites that include also the toxicological evaluation of them. So this requires, of course, specific analytical methods, testing methods, as we will see. And it includes compounds adding significantly to toxicological burden. Whereas in the first place, we don't need much interaction with the toxicologists. In the dietary risk assessment, the interaction of exposure scientists with the toxicologist is essential. So what you can see here, basically, it is that conceptually we have broken the residue definition process into 4 steps. So you can see that there is a split in these steps between residue chemistry areas and these and toxicology areas. And this is a rather natural divide, but what I would like to stress out is that the steps are not done in isolation. In fact, these steps are interconnected, and the flow moving from one step to another, we rarely go in one direction. So we need to establish, of course, the categorize the metabolites, and then use all this information combined to derive the residue definition. And for that, some workflows were built that you can see in the back. They're still draft. And it is important again to re-emphasize this interaction between toxicologists and residue experts. So let's see now what data do we need to derive a residue definition. As you can see here, there are multiple lines of information sources, as we call them. So we need data from the metabolism studies in crops, in livestock, or in rats, because we are interested in mammalian also metabolites. We are looking for the nature of residues in processed commodities, and how residues are identified in crop field trials and livestock feeding studies. And you can see, you can appreciate that for all these studies, there are specific OECD test guidelines that can be used to generate the data. After you defined, your metabolites, you can conduct toxicological studies. And again, the OECD has a library for them, but this can be region specific. Although there is some general guidance, we find differences from country to country. On top, as I've said, the residue definition can be derived for drinking water. And in this case, of course, we need additional data that comes from these studies. So moving now to the toxicological evaluation of metabolites, here I wanted to emphasize that the pragmatic approach had to be taken in order to define these toxicological properties of the parent compound and the metabolites, so we can have these health-based guidance values, or as they know, toxicological reference values, because in some cases there are technical difficulties, so sometimes we cannot synthesize all the metabolites, or we cannot test all the metabolites because there are animal welfare restrictions, also that will require a tremendous amount of time and resources. So really the guidance takes a pragmatic approach that involves really bucketing the metabolites based off if they are determined as a principal or lesser residues or trace residues. And then, of course, for the residues that are in the biggest quantity, we need to know more information about the toxicology. So there we can use in vitro methods like the Ames test or the mononucleus test, and look for potential genotoxicity, but also is the opportunity to use these new methods, the quantitative structure, activity relationships, and read across approaches and avoid testing. And then go even deeper to general toxicity tests, but using this new toolbox that now toxicologists can use, where you can see on your right side the trace residues require less demanding testing. So the assessment here is only for mutagenicity, and even a QSAR prediction can be used, as you can see. So here is also we delineate the process for residue definition. I won't go into details. It's very technical. It's there for you, the slides, to look at it. But please look ahead. Wait for the draft to come available so you can appreciate all this information. Maybe very quickly go to this more simplified scheme from that starts basically from establishing these candidate metabolites to be assessed in the residue definition, which are arranged to respective health-based guidance value per assessment group. And after we do that, we need to estimate chronic exposure for each metabolite and rank them in descending order. So in order that the exposure decreases. And then we have to ask ourselves if the parent compound is absent from the nature and magnitude of residue studies. If no, we have to adjust again the ranking and incorporate the parent, put it actually on the top. After that, we assess the contribution to chronic exposure, and finally, we consider acute exposure. So we can propose a residue definition that can be used for risk assessment. So the new guidance document is very well organized, so it provides the context, some initial information. You can find all the definitions and why and how we develop a residue definition. If you are an exposure expert, you can go to this section about evaluation of dietary exposure potential. So chapter 7, 8, 14, and 15 are more relevant, whereas for toxicologists, chapter 9 and 10 are more suitable for this expertise. And everything comes together in chapter 11, where the derivation of residue definition is explained, as well as we have dedicated chapters for the residue definition expression and the application of conversion factors if needed, and actually how to derive them. On top, the experts did an excellent job to really discuss special cases, these multi-use substances that I've said, explaining what needs to be done in case of residue definition for drinking water, and some exceptions like stereoisomers. And all that is accompanied by a case study. So the experts selected a very complex ingredient that has multiple metabolites, and it you through all the flows and explains the step followed. So I hope available. This revised guidance document will provide a structured and systematic approach to derive the residue definitions. It will give really the toolbox that is needed, not only from the industry members that who generate the data, but also for the risk assessors, so they can make the best use of the scientific data available. The guidance will also define the criteria which metabolites need to be assessed for which properties, and overall will give an aligned approach to assessing the toxicological properties of metabolites based on modern methodologies, and the concept for estimating exposure potential of metabolites with multiple and varying data. So it will be a really consistent approach for setting residue definitions, making best use of available toxicity and exposure data. And there was an attention in balancing scientific rigor, so be very prescriptive with practical applicability. And with that, I would like, of course, to thank the colleagues of this effort, Anya Friel from EFSA, Isabel Pilote from MRA in Health Canada, Mike Doherty from US EPA, and the drafting group on residue definition, who did a tremendous work in updating this guidance that will come out soon. And with that, I would like to thank you very much for listening.
Thank you very much, Magda. Am I having some issues? Thank you very much, Magda. And we will make sure that we share all the presentations and the link towards the document when it will be published. and we will hear from you later on in the second presentation that you're doing. We can now move on to Ye Yu Biao from FAO, who will explain good agricultural practice. Thank you.
So my presentation will include in two parts. The part one is the good agricultural practice, so-called GAP, and another part is the Codex classification of commodity. So it's a corporate custom used by JMPR in evaluation of data for pesticide residue for estimation of MRL. And then for the GAP, so good agriculture, we have very specific definition for GAP for pesticides use. So the GAP including the nationally authorized safe use of pesticides and then actual conditions which is necessary for effective pest control. So as you may know, so it encompasses a range of levels of pesticides applications up to the highest authorized use rate and applied in a manner which give a residue which is the smallest amount practicable. That means we should use according to authorized uses. So for the authorized safe use, which are determined at the national level for JMPR, we did not to determine the authorized use. But the national authority, they will decide and determine the national safe use of pesticides, and also including national registered or recommended use. Some countries they have a registration system, they will have a registered use, and some countries maybe they have currently have not yet have the registration system. So they may publish a policy or recommended use nationally, and also which will for sure decide in consideration of effective pest control. They will consider the public and occupational health and also environmental safety to consider together and to propose to authorize the safe use. And for actual condition, which including any stage of production of crop, so storage and transportation and distribution of food commodity or animal feed, because we also deal with the animal feed. And I think from point of view of MRL recommendation, the most important is the critical gap, the critical good agriculture practice. So that means the pesticide use pattern, which will cause the highest possible residue in food and feed, we also call maximum gap. So which always involve in the highest application rate, because normally the application rates make a significant contribution to the final residue in the crop. And then we also with the shortest PHI, so the shortest time from application of pesticide to the harvest of crops, and also means the shortest treatment interval, because some pesticides which were applied at several times, and each time we have a different interval, so which means the shortest intervals, and also means the method of treatment which leading high residue, because some pesticides they can treat as foliar spraying, and they can treat with the soil spraying, and we cause deep dressing, something like that. So, and the critical gap, we means the treatment which leading to the highest residue. We consider this one, and also we will consider the application times for a group stage for crops as well as for pests. And then one thing I want to highlight is to the gap is closely relating to the labels. Sometimes, in most cases, the label is only legal or reasonable source of the gap. So we always highlight, we use the currently approved label, not the proposed label or not the label which was not used anymore. So it's a current approved label. And the supervised trial has to be carried out ideally from the country in identical to the label country, and then try design with the similar climate condition and agriculture practice is well, very, very important for evaluation point of view. And then so we always highlight that we need a valid copy of the current label must be provided. So, and then if the label is not available in English, available in other languages, so the English translation should be provided. Because during the process of evaluation, we face a lot of challenge from the label, either with the only original no English label without the English translation, or the later or the dated version of the label. And then we have some mention some specific requirement how to present the gap. So we always the maximum application rate should be expressed as the kilogram AI per hectare or kilogram AI per 100 liter. And also we mentioned the number of application and target growth stage, and also interval between application and the pre-harvest corresponding to the specific application rate. Yeah. And also the crop is information on crop is very important for GAP, because sometimes we are included in a group, and sometimes we include in the individual crops. So if it is including group, should be list all the crop included in this group. Otherwise, unless they correspond with the actual Codex commodity classification, is same to the Codex classification. Yeah. And then and then the crop and the situation should be described exact as the approved label. So, and sometimes also we mention the number of treatment per season, but if only this information is on label, so that can be included. Otherwise, we're not including. And here is an example for the GAP, how to present the information on the GAP. So for the use of pesticides on which crops. So we have the current for the crop, and we have the current for the country. So which means the pesticides registered in use in this country and the label available from this country, and also with the information of the formulation used, registered. And the most important is to application information. We will have the application method as well as application rate, as we have said, so expressed as the active ingredient per hectare. And sometimes for the spraying, falling spraying or other spraying, we use the concentration, and sometimes we have a different number of treatment, and sometimes they have the interval, but sometimes they did not mention. But for most important, we have the information for the PHI post-harvest interval, which is very, very important for residue evaluation. So this is, I think, for normal pesticides GAP. And for the post-harvest gap, which is a little bit different. So we also have a sample for the post-harvest gap. So we also have the crop and the conch and the formulation. And then for the post-harvest, the more important is we need the specific, very detailed information on application method and application in the concentrate. So how to apply the dip or drench, or combine with dip and drench. And so and the concentration of the solution used, and also contact time is also very important. Yeah. So this is quite different from the normal agriculture. Yeah. This is for the harvest post harvest gap. I think here's the most important information for the gap and the critical gap. So should I continue with the classification of crops?
No, yeah, because we have our Australian colleague and Brazilian colleague.
I can stop here.
Yeah, we can resume your presentation after the presentations from Australia and Brazil.
Okay. Good.
Thank you very much.
Stop there.
So we will now move on to Afshin Shamsad from Australia, who will talk about supervised residue trials.
Hello everyone, I'm Leah and I have with me my colleague Afshin. We work in the Agricultural Chemicals Residue and Trade team at the Australian Pesticides and Veterinary Medicines Authority, or APVMA for short. I'll be covering supervised residue trials and then I'll hand over to Afshin to cover how we set MRLs.
Are you seeing the right present screen, Leah?
I'm just seeing our title slide.
Yeah, is it the right screen?
Yep, it's the presentation screen.
Yeah, the presentation one? Yeah, okay. All right,
yep.
I'll move it.
Thank you. So we just heard about what a critical gap is. Now we'll discuss the trials that are conducted, which aim to quantify the residues which remain after the approved use of a chemical product. Here you can see one example of all the pathways in which pesticides can be found in end products and exports. When assessing a use pattern, we need to consider each of the potential end products where residues could result. So supervised field trials or crop field trials are conducted to determine the magnitude of pesticide residues in or on raw agricultural commodities, including feed items. We expect trials that we see to adhere to the OECD Test Guideline 509, and trials should be designed to reflect the use patterns which would result in the highest possible residues. They should determine the rate of decline of residues in the commodities of interest and allow for determination of the supervised trial median residue and highest residue for conducting dietary risk assessment and calculation of the dietary burden of livestock, which we will talk more about later. Finally, the trials should provide sufficient data to allow MRL establishment. So the APVMA's agricultural data guidelines include Residues Data Guideline Part 5A that outlines requirements for residues assessment, and it includes things like the number of trials we would expect to assess in order to establish a permanent MRL, and other countries would have similar guidelines, I imagine. So trials should be conducted under maximum treatment regime conditions as proposed for the label. They should be conducted in major areas of cultivation of crops suited to cover a range of representative conditions in which the pesticide is to be used, such as climatic variation and seasonal variation. In some circumstances, trials from one growing season may be adequate, like when no finite residues are present and the MRL will be set at the limit of quantitation. If field and protected cropping situations are proposed, we would expect to see trials conducted in protected cropping, given that has the higher residue potential. The residue trials should use the formulation of the pesticide to be marketed and report the stages of crop growth at which the pesticide is applied. The method of application, along with the rate of application, number and timing of application, should all reflect the directions on the product label. And we would also expect trials to include a 2 times rate where phytotoxicity issues allow. A number of the supervised residue trials submitted for registration of a product should be residue decline studies, which show how the residue levels change with time. In decline studies, when a residue level is higher at a later PHI than proposed, this highest value is selected for MRL calculation. These trials are particularly important when maximum residues or harvesting or grazing occur over an extended period, or when chemical is applied to the edible portion of the crop close to harvest. Reverse decline trials involve applications being made to separate plots at different time intervals from the targeted commercial harvest date. All plots are then harvested on the same day, the commercial harvest date, resulting in different intervals from last application to harvest. This type of trial is appropriate where the commodity is likely to be harvested within a narrow time window. So sampling should occur at the proposed withholding period or post-harvest interval. Food and fodder samples should be taken at commercial harvest at the proposed harvest withholding period, and forage samples at the proposed grazing withholding period. The portion of the commodity which should be sampled in Australia is listed in our MRL standard, which you can see here. Codex portions are listed in the Codex classification of food and animal feeds, which Guibao will talk about later. And generally, the portions that make up the field sample are selected randomly, systematically, or from predetermined parts of the plot, depending on the situation. A failed crop could be grazed by livestock during its vegetative growth stage rather than grown to maturity. So the objectives of failed crop residue studies are to determine the level of pesticide residue that will occur during the vegetative growth stage of a crop. They provide sufficient residue data to allow appropriate grazing restraint statements to be set for failed crop situations, and provide data to determine whether animal transfer studies will be required to be submitted so that MRLs can be set in primary food commodities of animal origin. When we're looking at forage sampling points, at least one sample point should be taken on the day of application, one at the time of the proposed grazing withholding period, at least one point between these dates of application and proposed grazing withholding period, and at least one point after the proposed withholding period. So the provided analytical methodology must be able to determine the parent compound and its relevant metabolites, have a limit of quantitation at a level considerably lower than any MRL proposed for finite residues, and be substantiated by recovery data that shows that the method is effective for determining residues in the substrates analysed and at the levels under consideration. Studies on the stability of residues in samples over the time and at the temperature of storage should be carried out with representative substrates in a representative range of crops, whether that be high water, oil, protein, starch, or animal tissues. Generally, samples should be stored below -20 degrees Celsius to allow the best stability of residues, and the conditions of handling and storing the samples at all stages between sampling and analysis should be described. We would expect to see processing studies when processing may convert residues into a metabolite that has toxicological significance. Residue levels in processed food or feed are expected to be higher than in the raw agricultural commodity, or when the commodity contains residues above the limit of quantitation, and processing studies are mandatory. Processing studies are generally required when residues over 0.1 milligrams per kilogram are present in cereals, oilseeds, citrus, grapes, apples, potatoes, dried fruit, and sugarcane. And we have an example of results from a potato processing study here. Animal studies involve a single dose given to animals for 28 days at a level that is representative of residue levels in potential animal feeds. Animal transfer studies are required only when significant residues occur in crops or part of the crop fed to animals, and metabolism studies indicate that significant residues may occur in any edible animal tissue, or that there is potential for bioaccumulation of the pesticide. So two of the key values that come out of the supervised residue trials are the highest residue and the supervised trials median residue. The HR is the highest residue level found in a supervised residue trial after application at the critical gap. It's used for short-term dietary risk assessment, reflecting the peak residue level expected from a single or infrequent high intake exposure event. The STMR is the median of the residue levels found in a set of supervised residue trials. It's used for chronic long-term dietary exposure assessment, representing a typical or average residue level from multiple trials. And I'll now hand over to Afshin, who'll speak about using these values and setting MRLs.
Thanks, Leah. So hi, everyone. So the MRL setting process overview. So the maximum residue limit or MRL is defined as the maximum concentration of a residue resulting from the registered use of an ag-wet chemical that is legally permitted or recognized as acceptable to be present in or on a food, agricultural commodity, or animal feed. So to consider an MRL, we need supervised residue trial data conducted according to GAP, as we have heard from Leah and Ye. And we also need animal transfer study and residue definition, beautifully explained by Magda. And also like health standards, like health-based guidance values, such as like acceptable daily intake and acute reference dose. We also rely on food consumption data that is collected by Food Standards Australia and New Zealand, and trade assessment and public consultation. So public release summary is like we do the trade public consultation for new actives or new products which have never been registered in Australia. We do is public release summary and trade advice notice for commodities of like high export value. So here, like I will present to you a case study. So this cyflumethafen is a selective miticide, and this was like presented to APVMA. We registered it like recently in 2022. It was like the first registration and first product registration in Denisiraba miticide. So we established residue definition as because like I chose this example because like it provides a complex residue definition. So for enforcement in plant commodities, the residue definition is the parent cyflumethafen, and for assessment of dietary risk assessment in plant and animal commodities, and for enforcement in animal commodities, it's some of the parent cyflumethafen and 2-trifluoromethylbenzoic acid, also referred as B1. So from here now on, like I will refer to 2-trifluoromethylbenzoic acid as B1. So this product has been registered for use in other commodities as well, such as like almonds and apples and citrus. But I chose grapes. It's like publicly available information. It's like available on our website at apvma.gov.au. So the proposed GAP was for use of cyflumethafen in grapes for like wine and table grapes. Involved a maximum of 2 foliar sprays at 20 grams of active per 100 liter with a retreatment interval of 14 days in conjunction with a harvest withholding period of 14 days. So the grapes, including dried grapes and wine, are major Australian export commodities, and grape pomace is also fed to beef and dairy cattle at up to 20% of their diet. So as part of the application, we received 5 Australian and 12 US trials, including processing studies. So as you can see, there's like a lot of information, but like I've highlighted the one that I want you to pay particular attention to is like that's the way like we present data in our assessment reports. So in the Australian trials for the establishment of MRLs for enforcement, it's parent only. So the combined data set for both Australian and US trials was like 17 data points, and you can see 0.44 was the highest residue with the STMR of 0.15 milligram per kilogram. I would like to highlight here that like for JMPR, like if there are like more than one result of residues, like such as like if duplicate samples have been tested and like results are presented to us, then we take like the highest residue from that particular trial. Whereas like for JMPR assessments, we use like we have seen like average residues used. So this high residues will see further on, but like we use OECD MRL Calculator for establishment or recommendation of MRL. So this was MRL for both table grape and wine grapes. And for that, because like we received data consisting of like both table and wine grapes. And for dietary risk assessment, it is like parent plus B1. So we did like the assessment to get like the STMR, which I'll explain further. So the highest residue for dietary risk assessment is 0.48 and STMR is 0.21. And since, as Leah mentioned earlier, we need processing studies if the residues are higher than 0.1 milligram per kilogram. So in this case, we received processing studies. So the processing studies from Australia and US grapes trials demonstrated that parent saflumetophane residues did not concentrate in wine or juice samples. Therefore, the residues in wine and juice are covered by the recommended MRL for grapes at 0.7 milligram per kilogram. The highest estimated parent saflumetophane residues in dried grapes were higher at 4.64 times. So we use that one to recommend an MRL of 3 milligram per kilogram for dried grapes. That includes currants, raisins, and sultanas. So this is like an example of like how we set, we use like highest residue and STMR for using establishment of MRLs. Similarly, for grape hummus, the processing factor was 28.13, and we multiplied by the highest HR of parent saflumetophane residues in grapes, 0.44, that resulting in a saflumetophane MRL of 15 for grape hummus. And it's interesting, this one, like we have used STMRP for dietary risk assessment for the livestock dietary exposure. So for animal commodities, because this was like the first active, so we also established animal commodity MRLs. According to the OECD Animal Feed Calculator, grape hummus is fed to beef and dairy cattle in Australia at 20% of their diet, and because like other commodities also are fed at certain different percentages, we use all of them in the assessment of livestock burden. And the livestock burden was estimated at 0.71. And the animal transfer study, we had a lactating goat metabolism study, and the level that closest to the estimated burden was 13.5, and these were the residues observed after feeding 13.5 parts per million of that saflumetophane to goat. So the estimated burden was all below LOQ. So we recommended MRLs at LOQ. So the next part in determining or establishing the MRLs is like the overseas trade. So the APVMA's residue data guidelines part 5B outline the APVMA's requirement for the data relating to the impact on the overseas trade. And we compare like our proposed residue definition and the proposed MRLs with the overseas export markets. So this is just one example. And also like we assess like dietary exposure assessment using the international methodology, like international estimated daily intake and international estimated short-term intake. We use HR, as Leah mentioned earlier, like for acute assessments For short term, we use like higher residues, and for chronic, we use like STMRs. And then FSANs provide us like the consumption figures. So to see that like if the potential intake exceed the respective health-based guidance values. And then these MRLs are then published in our MRL standard for residues and chemical products. And this MRL standard features like permanent MRLs and TMRLs, which means like they can change. ERRLs, which are like the residues that are already present, could be present in the food, is legally permitted because of the previous use, and then MRL set at about LOQ. And then inadvertent residues, we have like Australia, New Zealand Food Standards Code. So these are like if in case of imports, so the Australia, New Zealand Food Standard Code, the main purpose is it sets out like MRLs for ag-wet chemicals that are permitted in foods for sale. And it contains MRL established by the APVMA and import tolerances. So that's like the food that is imported in Australia, but it's not used, and MRLs are not established. And it's jointly administered by Food Standard Australia and New Zealand. And there's a process for like MRL establishment, notification to World Trade Organization, and consultation periods at APVMA amends Food Standard Code. And that's the end of the process. And these are some of the references I used in the presentation. And that's the end of my presentation.
Well, thank you very much to you both for this excellent presentation. Thank you very much.
So that's the title of my presentation. First of all, thank you for inviting me to do that. I'm a university professor, but I have been with JMPR since 1997 as an expert from the FAO side, and since 2022 as a technical editor. So you can change it. So it was good because the previous presentation basically set some concepts for what we're going to talk today, which is the dietary risk assessment. That is a part of a broader concept, that is the risk analysis, where the risk assessment is the scientific basis for the risk analysis. And then you have risk management, and you have risk communication. So we're going to talk about scientific basis of the whole risk analysis process. Thank you. Next slide, please. And I think it's important to contextualize the GMPR within the FAO, WHO, and Codex Alimentarius system. So the GMPR is the risk assessor, and the CCPR is the risk manager. So, and as a risk assessors, we have two panels, the FAO panel, which recommends MRLs, STMR, and HR. It conducts the risk assessment together with the WHO, and the WHO is responsible for establishing the ADI and the acute reference dose. Of course, both panels are supposed to work together. And the Codex really received the recommendations of the GMPR. And if the risk assessment is okay, that means there is no health concern over our recommendation. The CCPR then accept our recommendation and establish Codex MRLs. And it's important to mention that we at JMPR, we only work with pesticide already registered nationally, as E mentioned before. Next slide, please. So we're going to go into the dietary assessment process. So it does have kind of three components: the toxicity components, the exposure component and the risk characterization component. And the toxicity component, it's the goal of this part is to establish health-based guidance values, the ADI and the acute reference dose. And the intake assessment use basically three data: the food consumption and the pesticide residue, food consumption, body weight, and the pesticide residue. And the risk characterization, after all, try to answer the question, is the exposure to that pesticide based on the toxicity and exposure is safe for consumers? That's the question that the risk assessment wants to answer. Next slide, please. And so the first part, that is the toxicology part, the objective is then establish the ADI and the acute reference dose. And although we are aware of the new methodology approach, but here we are using the most simple data. That is not the most simple, but that is actually the data that's really basis at the current moment the establish of these values. So you start from the data from the rat studies or dogs or mouse or whatever. And from that, you find, the objective is to find the level that no adverse effect was found, which is the no IL. But sometimes we don't have that level because the lowest dose did have an effect, and then we have to use the lowest adverse effect level. And this is on rats, on animal studies, but then we have to find the no IL is the safe level for the animal, but we have to find the safe level for humans. So we do that by applying uncertainty factors. And the default uncertainty factor is we apply, we divide the no IL number by 10 to extrapolate from the animal to human, and to another 10 to find what it would be the safest level for the most sensitive subgroup of the population. That could be children, for example, or people who has some physiological problem. And this is the default. So we divide the no IL found in the rat studies for the most critical effect. We divide it by 100. And that could be for the ADI and the acute reference dose. But there are some different uncertainty factor. It could be higher, where we don't have no IL, we only have low IL, so we can apply a default factor, a factor of 200 instead of 100. In some case, the uncertainty factor can be lower than 100. For example, if the studies were conducted with monkeys, for example, or even with humans, and then if it used to be some old data where the studies were conducted direct to humans. So you don't need the first uncertainty factor, because you just have to extrapolate from human to human just to take care of the most sensitive population of subpopulation of the human population. So that's basically, in a very summarized way, how we derive the ADI and the acute reference dose, or the acute reference dose coming from animal studies. Next slide, please. Next slide, please. And then we conduct the exposure assessment, as it was mentioned. At JMPR, we estimate the international estimate daily intake, which we use the STMR, as it was explained before. And just to remind that the STMR and the HR are defined based on the residue definition for dietary risk assessment. So it's the STMR value times the consumption of for international level, and we're going to mention it, divided by the body weight, and this is the summation of the intake and the body weight from the consumption of all crops that we are considering in that evaluation. And we use here the cluster diets. Just going to show the map for the cluster diet soon. And the body weight is 6 kilos or 55 kilos. I just want to mention that there is a discussion currently at JMPR and cCPR of using a different approach, which would be the current dietary estimate using National Dietary Survey data. It's called GECDE. But it's still under discussion instead of cluster diets using National Dietary Survey data, and also there are other assumptions to that, but it's still under discussion. So this method is, it's not at the moment impacting the setting of MRL by the cCPR. Next slide, please. Just to mention just a good overview of the 17 cluster diets, which has been using for a long time now. We do have to update this data for chronic intake, where the world is dividing 17 diet, as you can see here. Before there were another data set with 13 diets, but that's how it stands now for conducting chronic dietary intake by the cCPR, by the JMPR. Next slide, please. And the acute exposure, it's also mentioned, you can call it as international estimate short-term intake. It's not so straightforward as the chronic, because we have different cases depending on the unit weight of the crop, depend of the large portion. So while for chronic, it's the mean consumption, that's what it's in the cluster diet. Here we, as it's acute, so you are assuming that in one day, a person decide not to consume the average amount of that food as the person usually consume, but consume a large portion of that crop. So we have case one, where we use the large portion. Case one is when the unit weight is very small, for example, in case of small fruits, or also grains treated pre-harvest. So that's, and you use the HR. And you have case two, where the unit weight, let's see, the weight of an apple, it's higher than 25 grams. And then you assume that the first apple that you eat that day will have a very, is the unit weight and the highest residue times the variability factor. And we call it at the first apple that you eat, if you eat more than one apple, you're going to eat the hot apple, and which has the residue at level of HR times today is 3 times 3. So that would be the hot apple. And other apples will have the HR as it was determined. And the case 2 is where actually the unit weight of, that's the case of the watermelon. Normally you don't eat more than watermelon. You eat actually a portion of the watermelon. And then you just assume that watermelon has a residue, which is the highest residue times 3. And you have case 3. And in this case, you don't use the HR, you use the STMR. And this is for processed, for treat samples. The first case, is for sample grains treated post-harvest, and the third case is for sample treated pre-harvest. and also is applied for milk, eggs, which actually what you eat, it's a mix of milk or eggs that comes from different lots. So acute exposure, it's a little bit more complicated, but we do have a spreadsheet that actually calculates everything for us. So it's not that hard for us to do it. Thank you. Next slide, please. And the consumption data for the acute exposure, we have individual consumption data come from different countries, which provide also the 97th percentile, the unit weight for that consumption. And it's important to highlight that you don't estimate the acute exposure for every compound, just for compounds for which there is an acute reference dose set. Because for some compounds, the acute toxicity it's not important. So we establish that the acute reference dose is not necessary. So for those compounds, of course, if we don't have an acute reference dose set, we don't estimate the acute exposure and only the chronic exposure. All the compounds have an ADI, but not all the compounds have an acute reference dose. Next slide, please. And the final process after we define the toxicology, establish the ADI and or acute reference dose, estimate the intake, and then we have to compare. And we do that normally by dividing the intake that was just estimated by the ADI, sorry, here. It's in Portuguese, the acronym here, I'm sorry. And multiply by 100 because we normally express it as percentage. So that means that if the percentage is higher than 100, so a health concern may exist. And we also should say may, because there are a lot of uncertainties in toxicological evaluation and intake evaluation. So basically, if it's the intake is higher than what was supposed to be safe, and then a health concern may exist. Next slide, please. And just to highlight, to give an example, what was done in the last JMPR 2024. We do a chronic exposure assessment for all the compounds that were evaluated during the meeting. And you can see here that for none of the compounds, the percentage of the ADI exceeded 100%. And the range here of the ADI is the range for the 17 cluster diets, okay? And the highest percent of the ADI was 100 for fipronil, but for none of the cluster diet, for none of the compounds, the percent of the ADI exceeded 100%, so everything was okay. And then next slide, and these results are summarized in chapter 4, and the details of this assessment is on the annex. Next slide, please. And then we have the table for the acute estimated, the IESTI assessment. And here is different. And normally, if there is a problem, that would be for the acute, because it's really use highest portion, not the mean, and use the large portion, not the mean portion consumption, and you use highest residue in most time, not the mean residue. And last year, we found there was some exceedance of the acute reference dose for fempyroximate, for example, for some crops, and for pg-flumetofen for some crops as well. And in this case, we do recommend, because we are risk assessors. I mean, we as JMPR. So the JMPR does make the recommendation, although the acute exposure indicates some health concern. Here, for example, for this compound in eggplants is 160%. But next slide, please. When cCPR, next slide, please. When cCPR, oh, sorry, you can come back. Because the conclusion, oh, sorry. Yes, we do recommend we made the recommendation for MRL, for STMR, and HR, but they are not adopted by the cCPR for those crops here. So that's the difference. We are risk assessors, but it's up to the cCPR, who takes care of the pesticide residue within the Codex system, to decide if they want to forward and adopt that recommendation. And in those cases, it doesn't. So next slide, please. So that's it. Here are some old photos of the JMPR for probably almost 20 years ago. And here's my email. Here's the website of my laboratory, which is a pesticide residue laboratory, although I am a toxicology professor. Thank you very much. And I can entertain some questions. I still have some time here if someone has some questions. Thank you.
Thank you very much. Before moving forward to our next presentation, I would like to give the floor to Tony Wilson, who is from UK, and they have an initiative where they will send a survey on drone, and I will let him explain exactly what this is about.
Thank you, Valerie, and I'll just put it on slideshow mode.
Yeah.
There we
Perfect.
go. Okay,
yeah,
super, fabulous. We have an initiative here in the UK, the Health and Safety Executive, where we want to get a better idea of operator exposure to drones. So this is we're trying to do using a survey method, an online survey method, and we could really do with your help if you can. So just to give you a brief overview of what we propose to do, we're going to use an online survey-based approach to determine routes of exposure to pesticide when operating drones to apply pesticide. The idea here is that the more respondents to the survey that we get, obviously the more robust the data will be, and that's why we're trying to throw our net far and wide. So we want to better understand actual practices in the field, so that we can see how we can link our current understanding of the models of operator exposure to what actually happens. And this includes piloting the drone, talking about possibly drift issues, loading and mixing, where you possibly come into contact with the pesticide, and transporting, cleaning batteries, cleaning the drone itself, all of that sort of stuff we need to understand a bit better. And as I said, we want to link whatever we find via the survey, the data on that, to existing models and data on operator, resident and bystander exposure. We can make the questions we've developed available to all of you in PDF format to any country. But what we're requesting from you is, as folks who might know and people who might know operators, is to cascade it down far and wide. So if we can encourage as many operators to answer the survey as possible, we will provide it in English, French, Spanish, German, Italian, Japanese, and Hindi. And I think there will be an option to select which language you would want to use, and we will make the results publicly available. Our contractors will produce a report on the analysis of the data, and we also hope to publish in a journal, a respected scientific journal. Just some further details. If you agree to take part, let me know. Valerie, would it be okay to let you know? Yeah, that you'd like to take part. That's great. Thank you. And I will send you an email explaining the next steps. You'll then be contacted by our contractors, Farah, who will send you a link to the survey and cascade the email far and wide to any operators that you know that are in your networks. That would be really, really helpful to us. Our contractors will then sift the responses. By the way, it will be anonymous completely. Folks won't be able to trace back who has sent in the information and responded. And that will be explained in the email. Our contractors will then sift the responses, analyze the results, and a report will be written and conclusions drawn, and we'll make all of that available to all regulators that are involved. And like I say, we hope to publish an academic journal should the results be good enough. And that is it. If I just go back a wee bit, I'll leave my details for folks to write down. That's me. That's where I am. If you're interested in being involved in this, please let me or Valerie know. If you have any questions about it, perfectly happy to answer those questions. If you have any concerns or queries, but you would be really helping us out. And like I say, we will make sure that you have that data as well to help you in your assessments. Thank you.
Well, thank you very much, Tony. I'm not sure it was exactly the right audience here, but at least we will send the information, and people can forward the information to the right people. So thank you very much.
Well, I think every little helps, Valerie.
It's perfectly fine. And I might also send the information to the participants to the workshop that we organized, where we did have this presentation about drones back in April. So thank you very much, and we will now move on to the practical tools, and I will give the floor to Magda, so that she can explain MRL Calculator.
Okay, so thank you very much. I'm moving now to the second presentation about the OECD Maximum Residue Limit calculator. So it's going to be very brief, just to remind you that the
Magda, we're experiencing audio issues. It's on my end. Maybe
OECD MRL Calculator, which is to...
Sorry, Magda, to cut you off. It's just I think you're having
use an MRL often to make errors by overestimating the 95th percentile.
Magda, I think you keep getting cut off. Can you remove oh, okay. She's probably going to reconnect in a minute.
Okay, so I don't know if we wait for Magda or if we move on to Ye while she's reconnecting. I think we can do that. Ye, can we resume your presentation on the FAO crop clusters?
No problem.
We can't really hear you, Magda. You keep getting cut off. Is it your internet, perhaps? If you could just leave the camera off, I think that might be helpful.
Okay. Okay. Now, is it any good?
Yes, it is working now.
Okay.
Valerie?
Sorry for that.
Okay, so we try again, Magda. Can you cut your video just to make sure? And yeah, we will resume your presentation afterwards. Magda, it would be great if you could start from the beginning, because we are recording this webinar, and so that we have a nice presentation. Thank you very much.
Yeah.
Go ahead.
No problem. So this presentation is about the OECD Maximum Residue Limit Calculator. It's going to be very brief, and that's why, because we have a stable and very well detailed guidance to support this tool. Maybe to explain that the aim of the OECD MRL calculator is actually to produce an MRL proposal in the region of the 95th percentile of the underlying residue distribution, which is conservative in the sense that it will have a much greater propensity to make errors by overestimating the 95th percentile than by underestimating for most data sets. So as I've said, we have very good guidance that you can go through it. This is a kind of combination of two documents. So if you want to see how to use basically the calculator, you have the user guide. But if you want to learn more about the methodology, the statistical discussion behind how they decide to go to this approach, you can go actually to the white paper. So this is the DOI. You have the two documents combined there that you can access. So in a sense, the OECD MRL calculator is two Excel files, two Excel spreadsheets, one for single data set that you can see here, and they're hosted in a dedicated OECD webpage. And you have the link provided in this slide. So how this Excel spreadsheet is working, you have to input your data in the blue area. So the residues are listed here. They're expressed in milligrams per kilogram. You also have the top field where you can really enter the information about the compound, the crop, the region, country, and the GAP. And as you can see, this is automatically calculating the proposed MRL. So you have the unrounded and the rounded MRL, but also some useful general information about the data set that it appears in the top panel. So it is very interesting to see this range between lowest and highest residue, and all this is explained in the guidance. So something else, as you can see, there are a number of buttons on the top, so you can receive a blank page if you reset the file. You can also generate a table with your data if you press generate. And finally, you can use this information, copy basically this information and paste it in your report if you either click select frame or select table. The spreadsheet on multiple data sets use the same approach. So your input, your data here in the blue area that it is below, where the calculations appear in the top. So it's the same logic, but here you have multiple data sets. So to wrap up, the OECD MRL calculator is a practical statistical method It's provides it's very simple to use without extensive statistical knowledge from a user. So all this work has been done in advance for specialists. So you are that enables you to use it without really having a deep knowledge, statistical knowledge in this area. And furthermore, it produces a clear and unambiguous MRL proposal for most residue data sets and aims to harmonize the OECD countries' procedures. So I think this is my last slide. And again, thank you very much for your attention.
Thank you very much, Magda.
My pleasure.
So we will now move on and resume Ye's presentation on the FAO crop clusters.
Okay, thank you. So for the FAO cluster of crops, so we normally use the classification system from Codex. So we have published a document called Classification of Food and Animal Feeds. So which was firstly published in 1989, and we underwent a lot of revision or amendment, especially since 2012. So they have some significant revision from the classification, and then the final version was adopted in 2023 and then was published in 2024, the last year. I'll go to the next one. So here is the overview of the classification. For the whole classification, we have five classes of commodities. So in other words, the crops. So for us, most important one is primary food commodity or plant origin. That means crops. And so together with this, we will have in this classification we will have the primary food commodity from animal origin and primary animal feed commodity and processed food for plant origin and also processed food of animal origin. And because we have some criteria to group the crops, so if for some crops we cannot meet any criteria for grouping, so we will have for each catalog for each type crop we have a miscellaneous commodity group to accommodate the other crops. And I think for us, it's most important is class A, so primary food commodity for plant origin. And in this, we have five types of crops. So first type is fruit, second is vegetable, and third is grasses, including the cereals we use to eat, and the nuts and sap. And the last one was herbs and spices, also so important. Yeah. And then, for example, so for each group, so just for example, for group 1, citrus fruits, they have some description of this crop, mainly including the scientific classification system, family, genus, and species, and also some important trait of these crops, like for citrus, aromatic oil, peel, growth form, something like this. And also, it's mentioned that this is how the pesticides was exposed to these crops and how the crop was consumed. So this information, as said in the dietary exposure assessment, very important information. And for example, for this group, citrus fruits, they have divided into several subgroups. We have A, B, C, D subgroup. So subgroup A, so lemon and limes, and B, and mandarin, and C, orange, sweet, sour, and D, permanence. Yeah. And then from each subgroup, we have a group number and then commodity name, and with the scientific name for each commodity. So, and for each commodity, we have the code number. So we will use the code number together with the scientific name to identify the specific crop we are dealing with. We make the recommendation for MRI for this crop. And for the animal commodities, I think it's also very important for us, even though it's not a crop. But for animal commodity, I just want to mention, to highlight a little bit is because now we changed the old system to the new one, and then before we use different terminology for meat, muscle, and fat, and edible alpha, and also the meat will be transferred to the muscle, and then we also the pouch products will transfer to area products, something like this. And this is a specific how to the old system and the new commodity recommendation definition are used. And also we have the primary or the feed commodity. I think is very important for us today. And then classification for processed food from plant origin and processed food from animal origin. And for us, it's most important that there is a principle and guidance on selection of a representative commodity for the exploration of maximum residue pesticide for the commodity group. And then, so for example, if we have a representative crops of lemon, lime, mandarin, orange, and permanence, so we can recommend it for the whole group. And if we can only have the data for lemon and lime, we can recommend it for the lemon type subgroup, which include a lot of other species crops. And I think I want to highlight a little bit is very important is how the national registration crop or crop group match to the Codex system. Because for JMPR, we made a recommendation based on the Codex system, and if the national group is similar to Codex system, that's okay. But if it's different, then we have to deal with specifically case by case. Yeah. So just remind, it's very important to harmonize the national group system to the Codex one. I think that's all information I want to share with you. So thank you for your interest.
Thank you. Yeah. Thank you very much all for attending and participating, and for your time for the presenters. It's really, I'm very grateful, and I will keep you in touch by email.